Hello, 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 and welcome to the Health Insurance Insights Network with Donna. That is me. Happy Tuesday. Today, we are going to talk about medication coverage and gratitude, the gift of staying well. All right, now this Thanksgiving week, we know that yesterday we talked a lot about gratitude. We're just going to keep that going, not just saying it but showing it in the way that we take care of ourselves. It's one of the most overlooked, I'm sorry, and one of the most overlooked ways that we demonstrate gratitude for our health is simple. We stay consistent with our medications, especially when the calendar gets busy. Now, full transparency, I don't take any daily medications right now. But my husband does, and we work together to stay ahead of his renewals. So today I want to talk about what that looks like and why it matters, and how your insurance benefits can support you, not just when something goes wrong, but to help you stay well. Now, I always remind my clients insurance isn't just a safety net when things fall apart. It's a tool to help you stay whole and keep everything together. So, when you are managing those chronic conditions, consistency is everything. Controlled symptoms, fewer flare ups, avoided ER visits, long term protection, and consistency is gratitude. Gratitude says, I value how good I feel, so I'll protect it. Okay. When we feel good, we get comfortable, and comfort can make us careless. That's why proactive habits matter. Okay, y'all, I'm a little bit tired of talking. Okay, so if you skip a dose, what message are you sending your future self? You know, that your health can wait, that you'll deal with the consequences later. Um, just know your future self is counting on you to develop those healthy habits today. As holidays approach, pharmacies change hours, shipping slows down, and everyone is waiting until the last minute. Um, Please be proactive and double check things like your refill dates, your pharmacy closures, whether a prior authorization is required for renewal of your medication. If medication has changed tier or well, not changed because it's usually the end of the year, but as it gets closer to the beginning of the year in January, those tiers do start to change. So you want to make sure that you know that your medication is going to be covered in January. And you don't want to wait until January to find out. You want to know that now because there's a few little steps you can take to prevent that crisis. Um, so I'm going to share how we manage at home. My husband, he does take routine medications, but instead of waiting for that no refills remaining message from the pharmacy, um, which usually shows up, guess when? Right when you need it, because for whatever reason, we are wired to wait until the very last minute to go to the pharmacy, to reach out to the pharmacy, to reach out to the doctor. We wait until the last minute for everything. Um, but I track his refills. I have a schedule for it. I know when he takes it. I know when it was picked up. I know when it's needed again. We do get the messages. I do feel that some of the pharmacies do a really good job of sending you the reminders. Um, but we do get messages that say, "Oh, it's ready," and I'm like, "Oh my gosh, it's ready. Who's gonna go pick it up?" Because we didn't plan for that part. Um, but when he is approaching his last refill, we do go on and reach out to his provider's office. We use his provider portal and we send a message and they let us know, hey, I'm going to need to see him again, or I'm going to go on and send it to the pharmacy. Okay. Now, we don't wait until the last minute to do that because if you wait until the last minute, then what happens is you're going to be a week, well, 2 days, 5 days, a week without your medication, and then your symptoms start resuming. And that's what we're trying to prevent. You don't want those symptoms to presume, okay? Because you don't know if you're going to need an authorization. So when you wait until the last minute, that's what happens when you have those delayed renewals. It's Friday, you're panicking, it's the weekend. Oh my gosh, I'm not going to get my medicine until Monday. What am I going to do? I have hypertension, or, whatever it may be. Um, Rushed doctor's appointments. I mean, you're trying to now figure out, okay, now I have to schedule an appointment right in the middle of my work week. And hey, let's just be honest. Some of us work for jobs who do not want to let us take off. And some of us are not in a position to take off. So you don't want to find yourself in the midst of that type of dynamic. But you know what? Here's something important for this year. He is switching to a new insurance. So in 2026, I'm saying we, it's not we, it's me. I've already checked his formularies, so I know that his medications are covered, and I know whether or not they need a prior authorization. So that is something that y'all have to start paying attention to. At the end of the year, if you are taking medication for select conditions, um, then I would definitely check the insurance formulary just to see if that medication is on there, because it may not be on there. And you'll be surprised. What works for, let's say, one Aetna plan doesn't work for the other Aetna plan. What works for Aetna doesn't work for Blue Cross or Humana. I mean, every insurance is different, and you really want to pay attention um, to your medications. And just remember, those formularies can also change throughout the year. So, but I do feel that the insurance companies likely send you something to let you know that your medication formulary is changing. Um, because you don't want to be caught up in, especially just thinking about people who may, and this is really for any condition that you're managing, but I'm just thinking about RA with rheumatoid arthritis. Anyone who may be taking a medication for that, those formularies change all the time. And you don't want to be caught up in the middle of not having that med and then finding yourself in pain. Um, so yes, so before his plan starts, I mean, we are just in November. But yes, I have checked his formulary for 2026 just to make sure that his medications are covered. I suggest that you all do the same. You definitely want to make sure you're on the same tier, because some plans you may have to pay more money, and those tiers, it goes up, honey. I mean, and then you have prior authorizations that you need. So I mean, yeah, you want to check that. You want to know. And you want to find out about your step therapies, because sometimes you don't know what you don't know because you don't go look for it. Okay? Now, that's a quick check that could save you hundreds of dollars and 100 hours of frustration in January. And listen, if you're the person in your household that's doing all that invisible work, me, me. That's not just helping. That's care. That's advocacy. That's gratitude for the people you love. All right. Now, during the holidays, most refill emergencies are preventable. Yes, we get busy. We are running to the store. The kids are out of school. We are driving and flying to other states and cities or whatever it may be, countries. But um, doctor offices do close. They close. So for Thanksgiving, you probably should make sure your medications are taken care of not the week of Thanksgiving. Because let me tell you, if you waited until today, you may not get that medicine until next week. So you really want to move early. You should have already reached out to your provider. So hopefully you're not one of those people who tomorrow will be calling the doctor's office saying, "Oh my gosh, I'm out of Humalog." Because, honey, they may or may not be able to help you. So don't wait. Give them 5 to 7 days. At least it's gonna save you some frustration. It's gonna save them some frustration because for you, you are the only one who needs the medication. For them, they are dealing with multiple versions of you. Okay. So the holidays do pull our attention in just different directions. Caregivers especially tend to put themselves last. If you are a caregiver who is also managing chronic conditions, please take some time for yourself. Please, please do so. Um, because we know that caregiving, with an empty tank is only going to lead you to burnout. Take your medications on time. If you're managing someone else's medications, it is not selfish of you to take care of yourself. It's really gratitude for the body that you've been given and the bodies you're responsible for. All right. So moving a little bit forward, because this is a holiday week and we only have 1 month left in the year after this week. And January is a very important month. Okay. Every January, these are the things that happen that we don't foresee because from October the 31st to December the 31st, and really January the 1st, we are in the heat of it. But here's what happens in January. Your medications jump in copays. Some of them start requiring authorization. Your step therapies have changed. Um, and sometimes you're playing switches to a new preferred alternative, which may impact you differently than the current medication that you're taking. So check your 2026 formularies now. You don't have to check them today. This is Tuesday. I understand that Thanksgiving is Thursday. But next week, I want you to take some time to check your formulary for 2026 so it can save you a lot of stress later, just to make sure that your medications are still covered. Okay. Now, there is one more little piece that I would like to add to this. And this one comes from me working years in the insurance space. And I have spent a great deal of time working medications, with the medications that you pick up at the pharmacy, the injectables that you receive in the office, and the medications that you receive at the infusion centers. That is actually one of the things that I enjoy doing. I absolutely love getting your authorizations for medications. So I have learned a lot. I just want to reiterate that every January, authorization volumes explode. It's like poof. Because what happens November, December, things slow down and they simmer for a little bit. Everyone mostly has their authorizations completed and you're able to get your medication. But come January, everyone has a new plan. Your benefits have reset. Your formularies have changed. Deductibles restart. Um, you all decide to switch pharmacies. And then your providers have to verify everything again. So, so when you're waiting on a renewal, or an authorization in January, I want you to have grace for the teams, those nurses and authorization teams, um, who are working behind the scenes for you. They are not ignoring you. They are not dragging their feet. They aren't choosing to delay your care. They are navigating, not one of, because I would say one of, because really those first 3 months of the year are crazy, but January is the busiest month of the year for everything: authorizations, verifying your coverage, submitting documentation, chasing insurance companies, trying to figure out if your insurance changed. Because guess what? We don't have your new insurance card in the office, so we don't know. Okay? Um, and we are working hard to protect your access to your medication. So please, a little patience goes a long way, because not only are we working to try to get you that medication, you are also calling us. Your neighbor is calling us, and the neighbor down the street is calling us, and you're all calling at the same time, and you all want the same thing at the same time, and you all want to be the priority. Just to remember, you are the priority, but January is just a little bit crazy, so we need a little bit of patience from you. Now, if you can start these conversations in November and December, it'll make the process a little bit lighter for you. So if you know that your insurance is changing, well, not if you know in November or December whether or not your insurance is changing. You can go on your provider portal and update your new insurance card when you receive it, because we get these cards before January. So update the new insurance cards. You can scan those in, especially when it comes to medications. It's extremely helpful for the team that works on them to have the insurance card, um, because things work a little bit differently with those authorizations than it does with just the regular auth processes. Still the same. There's still step therapy, still things that they have to go through, but they're their numbers on the card that can help them to move the process a little bit quicker. All right. So again, in December, what you're going to do is check your formulary, and you're going to reach out to your provider and you're going to say, hey, I noticed that this isn't on my formulary. Is there an alternative? You're going to give them a copy. You're going to actually upload a copy to your portal if you have a portal. If you do not have an access to a portal, you need to ask your provider if they have a portal. And if they do not have a portal, drop it off at the office. Now, make sure that who you're dropping it off to know what they're doing. But drop into the office, give them a copy, let them scan it in, grab your card, and walk on out. Um, but here's what I want you to do: just some simple little systems, phone reminders, refill alerts, mail order options, and a medication list in your notes app. If we all have these, well, I'm not gonna say we all, but right now, cell phones are really popular, and there's usually a notes section in there. So in your notes section, just list those things. If you do get mail order, meaning you probably get your insurance in 90-day increments, have it listed. That way you know, okay, you know what? I picked this up on January the 1st, and I'm going to need this again before April the 1st. So March 15th, I'll start working on my renewal. Okay. That gives you 14 days. All right. Because creating that small little system for yourself will create and prevent a huge consequence later on. It'll help your peace of mind and my team's. Okay. So this season, I want you to give yourself the gift of consistency. And if you're the one who is quietly tracking medications for your family, like me, give yourself some credit. Refill early, track your renewals, check next year's formulary. And I know it feels like I'm being repetitive, you guys, but this is on purpose because I really do need you to understand how important these things are. Confirm your pharmacy networks. Know what pharmacies you can use because you're probably wasting money by going to a pharmacy that's costing you more money. And I'll just give you an example because I'm one of those people. I sort of kind of do that. Well, not sort of kind of. I do that. I go to a pharmacy that actually charges me a little more money, and I'll tell you my reasons just so you know. I can go to the pharmacy at my provider's office and spend less money. However, I'm one of those people. I don't want to be in those people's system. I work there. I don't want to be in the system. So I go to a different pharmacy. Now that's me. That's not what I want you to do. I want you to go to the pharmacy that's going to be best for you. But that's my reasoning. Um, I do also want you to ask questions before something becomes a problem. So just as a tip, if your medication isn't covered under your new plan, please understand because they like to tell you that that the authorization can be submitted prior to January. It really depends on a lot of other things. If your insurance is not changing, meaning you have the same plan, the same numbers, that sort of thing, then yes, they can submit that prior to January. However, if your insurance is changing to something different, you have you going from Aetna to Humana or United Healthcare to Cigna, we can't submit that. They're not going to allow us to submit that until January. That's just how it works. That's how it's always worked with any authorization I've done until the change is actually there when it's a new plan, they do not allow us to submit those. Now, someone else may have a different experience. You can drop it in the comments and let me know. But that's been my experience. However, you do have access to your formulary. You should have access now. You should have, if you are in open enrollment, you have access. If your open enrollment has passed, you have access to that formulary. You just need to reach out to somebody or go online to figure out how to access it, but you have access. Um, the earlier you submit any request, the fewer delays you're going to experience. Um, while you're protecting your health, I just want you to remember to offer grace again to those provider teams because they are working tirelessly behind the scenes. Um, I suppose this may not be the best analogy, but I figure that Super Bowl is a really, really big thing. And I can only imagine what those cities are going through to host it. But I'm going to say that January is a prior authorization team's Super Bowl. It is huge. And it takes a lot of work to be successful in that month. Now, staying well, helping someone else to stay well is one of the strongest expressions of gratitude you can offer for the life that you've been given. Now, if you track medications for someone in your family, I want you to drop a puzzle piece in the comments because caregivers, I see you. I see you and I acknowledge you and I appreciate you because I know that it is not easy. Now, I want you all to enjoy again this holiday week. And just remember, I am Donna. Thank you for watching. Thank you for participating with us this wonderful Tuesday with our medication coverage insights. And remember that it is your health, your insurance, and your power. Take care, stay consistent, stay curious, and have a grateful week. Enjoy.